Well, demand for baby formula has surged as parents struggle to find solutions. The federal government has taken bold action to address the urgent need. So with us now is Health and Human Services Secretary Xavier Becerra to talk more about this. Secretary, thank you for joining us. Parents are desperate. In some cases, we've had some babies wind up in the hospital because they don't have access to the specialty formula that they need. What is the Department of Health and Human Services doing to help ramp up production and get the baby formula into the bellies of babies across America?
Well put, first of all, and remembering those days when I was a father helping raise 3 daughters, you need it, you got to have it. And so we're doing everything we can to accelerate the production of that material getting into the hands of consumers. We don't control the manufacturer, we don't buy it, we don't distribute it. But what we can do is help from the point of production to the point it gets into parents' hands, accelerating that, because right now supply chain issues, the fact that COVID has disrupted supply chains, and also the fact that Abbott, one of the largest producers, had to voluntarily close down one of its plants, has really impacted supply.
Mr. Secretary, you mentioned you don't control, the federal government doesn't control the private sector, obviously, at all in any way, or any of these companies. So what is the private sector doing on its own? What are these companies doing on their own to help in this process?
Well, I think now they realize that this is a real issue. And unfortunately, when a particular industry, especially one that's as consolidated as this one, has a problem such as a voluntary shutdown, it does impact the amount of supply that's out there. They're doing everything they can now. We're working with them to try to make sure they ramp up production. That's not been enough. Now we're working to try to bring in supply from abroad. FDA, which has to make sure that it's safe to bring from abroad, is working closely with the manufacturers so that there's little delay in getting it from a point outside the country into the U.S., into the hands of parents.
So I've learned a lot more about baby formula now. When I had a baby who drank formula, all I cared about was that it was available when she needed it. But to the point that you just brought up, now we're learning that there are really just a handful of manufacturers in this country, and when one goes down, it's a big problem. But also specifically with Abbott, you know, it was shut down in February, and there's an ongoing investigation. It's not even really clear that the bacterial contamination that led to the shutdown is actually connected to this particular facility. And so I wonder, Secretary, if it's time to take sort of a bigger picture look at formula manufacturing and regulating in this country. Do we need to make some big changes here?
I'm with you. We don't have the authority at FDA to even request that companies tell us what their plants look like inside. We have to go in and inspect them. And if we find something, then we have to be able to prove in court that there's a reason to shut them down. We got Abbott in this case to voluntarily shut down because I think they saw what we saw. But it is crazy to believe that in the 21st century, we don't have the authority to really get the industry, a very consolidated industry, to tell us what things are looking like inside. We have to wait till a problem occurs.
So I'm curious, though, the plant has been shut down for many, many months. It's not until there was a lot of sort of media attention, a lot of outraged parents, and suddenly it seems like the plant's ready to reopen in a handful of weeks. People are going to wonder, how does that work?
Well, fortunately, the plants in the U.S. operate in a way that keeps them, for the most part, clean and safe. It's whether they are staying on top of what they're doing to make sure it's clean and safe. Other places around the world may not have the same level of oversight. But as we see from the shutdown of Abbott, we still have to do more. I hope you all continue to report this, because when just a handful of companies can control the supply of something as essential as baby formula, this is not toilet paper, and you need to have a supply readily available. We need to make sure that they're on top of it. If they're not policing themselves, then we have to do more to make sure we are doing the right thing for parents who need that supply.
Yeah, otherwise, I mean, we could continue to see these sort of things continue to happen. Mr. Secretary, how much baby formula is being brought in from other countries? And I ask this to ask, you know, if we have the capacity right now to meet parents' and babies' demands as needed.
Yeah, so we are working aggressively with some of these companies, including companies that aren't necessarily part of that small network of companies that usually provide the domestic supply, to see if we can bring some more in. You heard about the Nestle supply that came in recently from Switzerland. We made that possible. Essentially what we did was we accelerated the ability to get that product into the U.S. rather than run its usual course under a very bottleneck supply chain. We're going to do that because we need it now. But again, we don't produce it, so we can't control how much there will be. What we can do is try to break all sort of impediments to make it possible to bring it in as quickly as possible. We're also going to make it possible for them to produce more quickly by making sure that they're first in line for the raw materials they need to make the formula. And so that way the bottleneck in raw materials doesn't impact their ability to produce. We're going to do all we can to make it possible for them to produce and distribute. But it's up to them to produce and distribute. And, you know, you want to be a very consolidated market. You want to have essentially a corner on all the market, then be responsible and make sure the product's available.
Would those changes be permanent or just enough to get us over this crisis?
Well, you know, we're investing quite a bit to try to make it possible to get that supply in faster. We'll do it as long as we need to, but this should not be. The industry is a mature industry. They make a lot of money. They should be able to make that product available when it's needed. Parents need that. And in some cases, some of that baby formula is the only thing that some of these babies can actually consume. And so there's a responsibility. If you're saying you're going to let the private market provide that, then the private market has to step up. You cannot afford a market failure, as we've seen today when it comes to baby formula, because lives can be at stake. And so we're going to do everything we can. We've actually, from before this crisis began, for more than a year, we've been asking Congress to give us more authority to really be able to take a closer look behind the curtain at how the industry operates.
Mr. Secretary, before we let you go, one quick question about the monkeypox issue here. As you know, the U.S. investigating possible cases of monkeypox here in the United States. How concerned should Americans be? And do we have the resources here to tackle a potential outbreak?
Well, we should always be concerned anytime a virus that's contagious, that can really impact lives, and in some cases lead to death, it starts to infiltrate the country. We're on top of it. Here I can tell you that our people, our personnel who deal with preparedness and response have been on top of this one, and we are ready with both vaccine and vital medication to try to make sure that we address it here. But we have to do the contact tracing, all the things that keep it from spreading. But in this case, I think what you can rest assured about is that we're ready if we get more cases, but we're trying to avoid any spread in the U.S.
Secretary, one more question for you because you're still here. You know, we've been covering sort of the push by some of the vaccine manufacturers to create a vaccine that's good for the young. We're talking about a COVID vaccine for sort of the youngest Americans, 6 months to 5 years old. And it looks like things are progressing. But I got to wonder if the funding is not available, even if there is access to the vaccine, if the funding is not available, then what happens? You know, will we have enough funding to sort of get as many people vaccinated, children vaccinated, if their parents want that to happen?
What a great question, but what a crazy question to have to ask, that after almost 800 vaccine shots administered in this country, that we may be at a point where Congress will not provide us the resources to finish the job, to make sure now our youngest Americans will have a chance to get vaccinated as well. We have been preparing as much as we can to deal with the virus, including providing vaccines for children 6 months to 5 years of age, waiting for FDA to give the approval sign to start doing so. So we put aside some money to make it possible, but it really wouldn't take us beyond the summer, the fall. If we need it beyond that, then we're in trouble. And then
what happens?
You don't want to have to, well, you know, it's hard for me to tell you other than that we won't have the resources to purchase the supply that we would need. And, anyone can sort of guess what would happen if you don't have the vaccines available. Yeah. Unfortunately, that would be the case. Fortunately, so far, Congress hasn't allowed the funding to lapse to make it possible. And that's why Americans have had access to the vaccine when they've needed it, where they've needed it. That should not change. We hope the Congress acts soon to provide us the resources.
The Secretary should point out that you recently tested positive with the virus. I should ask you how you're feeling. You look pretty good.
Yeah, I don't know if you can, my voice is gone, but actually that was because I had a cold beforehand. I'm here in Berlin, Germany, isolating, and I've been testing negative for a while, but I can't leave until I've gone the course of days before I can travel. So I'm coming to you from Berlin, Germany, but we're still working. I'm doing good.
Okay.
All right, Mr. Secretary, hope you are on the mend, and there are worse places to recover than Berlin.
Yeah, except in a hotel room.
Yeah.
That's true. Thank you, Mr. Secretary.
Thank you.